In the Koch Institute, we challenge ourselves to approach cancer in a way that's different from everyone else and make sure we're addressing the big questions.
We try to identify the most audacious problems that we can think of in cancer, the things that people often say are impossible, undoable.
We all have a drive to understand and defeat cancer.
People come here because they want to take on hard problems. We bring together scientists and engineers to approach things in a way that hasn't been done before.
And that leads to this real explosion of ingenuity and innovation and new ideas.
There is an energy here. When you bring a group of brilliant, determined people together, anything is possible.
MIT has a very long history of bringing different disciplines together to solve problems. The Koch Institute for Integrative Cancer Research is setting a model to solve cancer in entirely new ways.
We often use this phrase convergence, meaning engineers and biologists with different expertise come here every day to work together, taking on really, really challenging projects.
There's a natural flow of language that takes place here. People are talking biology, they're talking engineering, they're talking math, and we end up having these dialogues that you wouldn't have any other way.
Every day I come in, I feel that I'm going to have a new conversation because that's the culture here.
Our ability to understand and manipulate physiology and disease is really limited by the tools we have at our disposal. At the Koch Institute, we have the tremendous advantage of being surrounded by engineers who are experts in building those kinds of tools.
There are so many collaborative interactions, and in doing so, we bring all of our different tool sets.
I'm a pediatric oncologist who's really passionate about drug delivery.
I am the chemical engineering department head at MIT.
And I'm a chemical biologist and a systems biologist.
Our three labs are coming together.
And in this collaboration, our idea is that we would be able to design nanoparticles so that they target specific cell types.
We've now been able to identify specific biomarkers that will prime a patient to take on a new therapy involving a lipid nanoparticle.
It's really a door that will allow us to understand how nanoparticles interact with cells. And that is the key to designing a means of addressing all of these really important cancers.
One of the things that excites me the most is that feeling of being able to make discoveries that might impact the life of patients with cancer.
We know people we've lost to cancer and would really like to change the terrible prognosis that many cancers still have.
Whenever I've talked with postdocs or graduate students, they are more enthusiastic than anyone I've ever seen. And I know we are preparing, we are training, we're educating the cancer researchers, cancer doctors of the future.
I study cancer cells and how they use stress response to become resistant to cancer therapy.
My research at the Koch Institute is focused on finding newer and better ways to detect and attack metastatic cancers.
My work underlies trying to understand how and why patients become resistant to chemotherapeutics.
We're trying to understand how these non-coding DNA contribute to the formation of cancer and ultimately in the cancer therapeutics.
Everything is really geared towards trying to make an impact on the life of a cancer patient.
A lot of the big ideas that we're currently using in the clinic really originated within the Koch Institute.
I encourage our faculty, if you have a great idea and we can move it into the private sector, we should do that as quickly as we can. That is really how we can make sure that our discoveries reach and impact the most people.
Partnerships and collaborations really have a huge impact on where our research goes, whether that's a clinical partner or an industry partner or an investigator spinning off their own company to take that research to the next level.
There's lots of projects ongoing in the Koch Institute that I think have the potential to revolutionize cancer medicine. When we put our mind to problems, working together, we can solve the big questions that really face cancer biology today. I think it has led to some pretty spectacular results, and it's making a big difference.